Hello and welcome back to GP Video Podcast by Nadia. So today we are continuing the topic of metabolic syndrome. What is metabolic syndrome? Metabolic syndrome is a cluster of risk factors or conditions that together increase a person's risk of brain stroke, heart disease, and type 2 diabetes mellitus. These risk factors are 4 in number, which I personally classify them as one single parent and 3 offsprings or 3 siblings. So the parent is obesity or high body mass index or high weight. And the offsprings are number 1, high cholesterol, high blood pressure, and high insulin resistance or sugar levels, or eventually type 2 diabetes mellitus. So 4 factors. Cluster of 4 risk factors that are dangerous for brain, dangerous for heart, and causing type 2 diabetes mellitus, which is the mother of all diseases, and chronic kidney disease as well. So almost damaging all vital parts or organs of the body by just being there. So who the parent is obesity, or basically in metabolic syndrome, the central abdominal obesity is considered very important. Then high cholesterol, high BP, and insulin resistance, or a condition in which the body cells are resistant to insulin for it to make sure that the sugar is consumed in the body and it's not there in the blood. And so eventually leading to type 2 diabetes mellitus. So 4 risk factors, 4 symptoms, 4 conditions that together cause this condition called metabolic syndrome. Metabolic syndrome is also known as syndrome X or insulin resistance syndrome. People with metabolic syndrome have 2 to 3 times the risk of having a heart attack and a brain attack or stroke or chronic kidney disease, or all 3 of them, than people without this condition. Metabolic syndrome affects many adults in Australia and can also affect children and adolescents. Now, what causes metabolic syndrome? The syndrome, which is a cluster of risk factors, which are 4. So basically your question could be that when all these 4 factors are present, then we will call it as metabolic syndrome, or it could be 1, 2, or 3, or what is the condition? Yes, usually when all these 4 are present, we will call it as a metabolic syndrome. But as I said, these are all offsprings or siblings. So even if there are 1 or 2, there are always chances of the other 2 to be present. So for example, if a patient has high cholesterol but does not have high BP at this stage, he will eventually develop high BP because cholesterol is going to clog the arteries, is going to make the lumps, the plaques, and then the person is going to have high blood pressure. Again, if a person is only obese and does not have high insulin resistance, high blood pressure, and high cholesterol, if he is obese and his BMI is going dangerously high, he's eventually going to get there, especially the ones who have central abdominal obesity. So though all of those 4 might not be present at one point of time, but they eventually are going to be all together. So that is why we call it as that is why I actually call them as parent and offsprings or siblings, or just all very closely related to each other. So the elements that cause or contribute to metabolic syndrome are influenced by lifestyle factors such as poor diet and very low physical activity, and also unfortunately by genetics. A sedentary lifestyle with a poor diet is thought to be the most common cause of metabolic syndrome. How is metabolic syndrome diagnosed? A person may be diagnosed with metabolic syndrome if they have at least 3 of the following: high waist circumference, raised level of triglycerides, which is one of the bad forms of cholesterol, high blood pressure, low levels of good cholesterol, and type 2 diabetes or insulin resistance, or increased blood sugar after fasting. So they have given 5 for diagnosis, out of which if 3 are present, we will call it straight away as metabolic syndrome. So what are those 5 criteria? Again, high waist circumference, which we called as obesity before. Number 2, high levels of triglycerides, which is again the bad form of cholesterol, low levels of good cholesterol, high blood pressure, and type 2 diabetes or insulin resistance, or high fasting blood sugars. So out of these 5, any 3. What is the treatment for metabolic syndrome? Treatment of metabolic syndrome is focused on the same lifestyle measures that can help prevent it in the first place. These recommended lifestyle measures include maintaining a healthy weight or losing weight, which should improve insulin resistance, lower blood pressure, and improve cholesterol levels. So you can see how they are all closely linked to each other. High sugar food will eventually lead to insulin resistance, like the insulin that is being produced in the body is good and is enough, but because there is so much sugar in the body, eventually the cells of the body will start becoming resistant to insulin. Then high sugar gets converted to high cholesterol, and then on top of it, if you are eating food with high cholesterol, then again that is another factor, and then high cholesterol is going to clog the blood arteries, and then that's going to cause high blood pressure. So they all are going to lead to, like, it's a vicious cycle. So they're all going to lead from one to the other. So exercising for 30 to 60 minutes on most days, this will help reduce weight, improve cholesterol and blood glucose levels, and help lower blood pressure. Eating well by reducing kilojoule intake if we are overweight, reducing saturated fat and salt, and increasing whole grains, fruits and vegetables. Stopping smoking and reducing alcohol, almost stopping alcohol as well. So apart from physical exercise, apart from diet, apart from maintaining a healthy weight, stopping alcohol and smoking is also very, very, very necessary. In children and adolescents, lifestyle changes like reducing screen time and increasing sports can reduce the risk of developing metabolic syndrome later in life. Now, I am very, very pro medications as well. So I'll talk about the medications. That this was all about the diet and lifestyle interventions. But once the lifestyle interventions, even though either we can't do them or they are not helping, then we of course have to resort to medications. There is no other way about it. Then I'll talk to you about medications for metabolic syndrome tomorrow.